So, when you have to stop. Hello, everyone, welcome back. And today, here I'm going to talk about heart. And basically, after watching this video, you will get to know how you yourself can take care of your heart on daily basis because it's one of the vulnerable subject at this point of time in our society, where we used to see next our next door somebody has left away due to heart attack and all that. And so it's become something where we have to be aware of. But being a general person, being a regular person, it's very much difficult for you to get healthcare professional or medical support all the time. So by how living a healthy life, how you can take care your heart, so that I am going to talk in this video. And after watching this video, where I will give you three simple tips which you have to look at by yourself, and you have to take care yourself through those tips. So before tell you those three tips, let me introduce you about heart a bit of. Probably some of you definitely know about this, but some amount of. But still, before getting to those points, it's required to have some overview on heart. So what heart does, basically, that all we know, it's pumps the blood throughout the body. So here heart beats for 60 to 100 beat per minute, which is regular one, which is normal one. So, and also it needs to be rhythm needs to be in balance, and it should not be irregular rhythm. So this is the heart, the way that basically it functions, so 60 to 100 beats per minute, and it pumps the blood throughout the body. So this is a little information, but right now we are talking about the health of the heart. So how it our heart health it is being deteriorated, and how we need to take care of. So basically, in this context, what I usually found in my experience, the recovery food and conditioning is very much important, and there we are making such mistakes, and therefore we are getting those unconditional consequences. So in that context, if we talk about, first we have to talk about recovery. That recovery is very important, and how we can get it: rest and food, which actually usually important for the recovery. And therefore we need to take a proper sleep, rest in between training, and also take proper food as well. And food here also is important. So food, basically, the main thing is that the protein is always important: calcium, magnesium, potassium, and along with the sodium if it's required. But usually sodium is not required, because you already get sodium a lot of. So after that, conditioning, where athletes usually mostly actually they are those used to a fitness enthusiastic person, they usually does some of those mistakes where they need to do overuse their body, and therefore heart also getting extra load. And that's a problem that we have to actually we usually face, and therefore we have to face those heart issues and all that. And so we have to make good training plan, and along with that, pre-participation medical evaluation, that PPME is very much required. What we usually don't do, because we don't have much idea about this. Sometimes I felt, and out of that we usually don't afford that, or we don't care about that most of the time. So we have to be aware of in conditioning as well, where we have to conditioning properly, don't overuse. Training plan should be proper, and also before that, always if possible, do pre-participant medical evaluation, where you have to go through ECG, blood test, couple of, and all that, where your expert or your coaches can find that where you are standing on at that point of time, so they can make your plan more effectively. And out of all of this, the main thing is that one of the main things is genetic influence. And if you have a genetic influence person, those have a past, a family history, where they have faced some heart attacks and all that, and that the traits are going on, and you have also got that genetic influence with in you in yourself. So we have to do that genetic test where you can find that you have the probability to face such heart disease in future or not. So therefore your coaches or your healthcare professional can make such plan for you as earliest as possible to take care your heart health as well. So this is how actually uh, we have to look at that how and take care of our heart as well. So now on daily basis, what are the three tips and process points that we have to look at, and that I am going to tell you in detail. So after watching and after listening those tips, definitely you will be able to take care your heart by yourself. Now I'm going to talk about the three tips which you have to follow on daily basis to take care of your heart by your own. So first, you have to take a proper sleep at night. If you sleep for 6 hours, 8 hours, whatever, and make sure one thing, that everyone doesn't sleep for a certain point, I mean certain hours of time. Okay, so we are usually used to take sleep in a different way right from our childhood. So we have been already used to with that circle. And actually the thing is, somebody can take 6 hours of sleep, somebody can take 8 hours of sleep, somebody can take 10 hours of sleep. It depends, okay, man to man vary. So why I am talking about that? Sleep, it means rest and recovery. Ultimately your body gets recovered. So if your body needs that 10 hours of sleep for recovery, it needs that, and that has been already, I mean, you are used to with that for a long time, and you cannot change on instant. So you have to take the things lightly, change it gradually. If you need to manage your time, try to change it gradually, okay, or try to reduce it gradually. Okay, so this is how you have to take the things like this and take your sleep properly. Next, right after we sleep, when you wake up in the morning, take a measurement of your pulse. If you have a pulse oximeter, that's very good. Or if you don't have a pulse oximeter, you can measure your pulse manually. That all we know, from radial artery we can measure our pulse. Okay, and there you have to find 60 to 100 beat per minute. If it's so, that's good. Along with that, another thing you have to check, that whether that rhythm is regular or irregular. It means you can perceive the things that it's like beep, beep, beep. It means it's in a rhythm. Okay, or if it's not in rhythm, okay, you can understand the beeps, that it's not, it's going like this in a regular way, so it's irregular. So in that context, you have to aware of. So now, if your heartbeat is not regular, it means it's not within 60 to 100. But somebody also, if somebody I have seen above 90, when the heart rate goes up above 90, that time they started getting the problems. So this is something, it varies man to man, person to person. So you have to understand that if it's above 100, definitely it's not good, not regular one. But also if it's more than 90, and if you are not feeling well, so that is also not well for you, that is also irregular for you. Okay, so if the heartbeat is irregular, and also your the rhythm of heartbeat is irregular, it means both are disturbed after wake up in the morning, in that day, particular day, you have to aware of several points. Those are the points are, you have to stop your practice. If you are an athlete, you have to stop your practice. And also, along with that, if you're not an athlete, so you have to stop any sort of strenuous activity, where you have to walk much, where you have to run much, when you have to take some weight to carry from somewhere to another where. Okay, so these are the activity you have to stop it for that day, or you have to do it more cautiously, or more slowly, or gradually if it's possible. Okay, so that's the thing. Out of that, in food aspects, if I talk about, you have to stop taking any sort of spicy food for that day. Spicy food, fried fruits, fatty foods, and also the simple carbs. It means what I am talking about, hearts basically actually the inflamed state, if it's goes up, so we are getting heart issues, we are getting those plaques and all that. So these are the aspects we have to take care of. It maybe heart is not working at that point of time, in many issues it can take place. But generally, after without having any diagnosis, it's not possible to proper diagnosis, it's not possible to get the exact thing that what is exactly happening there. So generally we have to avoid these foods, okay, spicy foods, fried foods at home or at outside. Out of that, fatty foods, basically actually fatty foods, it means egg, likes egg yolk, like you can say red meat, like you can say chicken you are taking, but not, you should not take the leg portion, okay. So this is how you have to avoid those fatty foods. And the simple carbs, which all we know, added sugar, simple sugar, and fruit juices, or any such kind of carbonated juices, like we used to get cold drinks and all that, all needs to stop for that point of time. And along with that, those are to drink alcohol, so they have to also stop taking alcohol for that day. Very strictly I'm telling you, because alcohol is one of the carbohydrate, okay, which is a simple carbohydrate as well. It also affect our not only heart in various ways. So but sometimes some studies says that it has been proved, some study that those who consume alcohol, they are less chance to face the heart attack than those don't. But it's somebody says might, it's somebody says not, but I want to goes with the logic. It's a carbohydrate, and basically if I consume for the time, it can turn into fat, it can start plugging up, okay. So you have to go with the simple equation. So there you have to stop drinking alcohol, okay. Now, out of these things, it's you have to don't do these are the things. Now what you have to do at that point of time for the day, so there you have to take your food mostly home cooked, number one. And home cooked food should not be turned into restaurant. It means you are not making foods in such spicy way, in such fatty foods, oils and all that, okay, that you have to stop. And also it should you should not consume the uh, simple carbs as well. Out of that, you have to make your foods, and that should be cooked in home, that is more safe. Because in outside you will probably get those overcooked or overheated something, or overcooked something, so which is more harmful for that point of time. So home cooked food with bit caution, okay. Out of that, you have to mostly focus on that point of on that day on vegetable foods, vegetable curries, veg salads, all that. But don't take fruits, also you can take, but don't take the fruits most or much ripened one, okay. Like you can take banana, definitely I recommend that. On that day you need banana, like along with vegetables curries, vegetable salads, fruit salads, you need banana as well. But some of those foods like banana, other foods, those gets ripen and becomes more sweeter. And these are those are the foods you have to restrict a bit. You should not take that much ripened one, okay. So but here, along with the vegetables, I recommend go with banana, and also low fat curd, which is also recommended, because curd usually have good amount of, I mean, calcium, potassium, magnesium as well. So it helps. These are the don't and do you have to follow for that. Exceptional thing is what, if your heart rate is not touching 100 or above 100, Rather it's opposite, less than 60 or around 60, where you are a patient of low blood pressure. In that point of time, you should not restrict some of those foods, like you should not restrict simple carbs. Okay, out of that you should not restrict, say, 13 hours fasting. Okay, you should not do 13-hour fasting for that point of time. And also here I missed, you have to in do when your heart rate and all that is not going, heart rate and rhythm is not going well, so you have to do 13 hour of fasting as well. If your heart rate is not normal, which is touching 100 or more than 100, you are getting you are feeling uncomfortable, and out of that, your heart rhythm also is not irregular one. So here, along with those veg curries and salads and banana curd, you have to do 13 hours of fasting. But that should not be implemented when, if you have a low blood pressure, when it's touching 60 or lower than 60, and that time you have to stop doing 13 hours of fasting. You stop following, rather, 13 hours of fasting. And along with that, you have to you should not restrict yourself to take simple carbs, okay, for that moment. And here, in simple carbs, I would recommend you should go with glucon D, which is very good for me. I am not going to talk about it. But out of that glucon D, you can go with anything, whatever you want for that point of time to raise your blood pressure. Now, in the second point, if you are getting the regular heartbeat and regular rhythm, you don't have any issue right in the morning when you are checking. So in that point of time, for that day, you are not restricted with anything, but definitely that should be followed up in a measured way. It means you can do your activity, you can do your practice, athletes, no problem, but in a measured way. It means when you are doing practice, we usually do this problem, or when you're doing gymming, or when you're doing fitness activity, any sort of, you usually do this problem that we don't follow up your heart rate actually. So it's not that when you are doing any exercises, our heart rate goes up, and that should be restricted at a certain point of time. Usually we say that it should be restricted 80%, and not it should not be exceeded after that. So in that context, you have to measure your heart rate as much as possible quickly, and then you have to, when it goes up, you have to take a break for 2 minutes, 3 minutes, and let it come down to your normal heart rate, like 70, 80, whatever it was right before you start your workout. If you measure, or in the morning when you measure it, okay, so let it come down as much as possible close to your normal heart rate, and then again you start. Okay, that's the protocol that you need to follow up. And when you are regularly follow up your routine, your workout and all that, no, so gradually it will be automatically uh, be in balance. Your heart works very efficiently, and you don't need to give much time to recover. It will automatically get starts recovering quickly. So this is how the things progress. We should not force in a very short time. We have to force it to be stable enough with our work schedule and all that, and our targets and all that. It's a physics. We have to give time, we have to follow up a protocol and routine, so that you can get the benefit of it in very safe way. Out of so this point is very important. When you don't have any restriction, you have to follow this protocol. And out of that also, you have to restrict your food, where you should not exceed any of the foods in a much quantity. You should be in balance. Okay, and along with that, it will be continued that fasting for 13 hours. So this is the second point is all about. if you are if you don't have any issue, you have to follow these points. Okay, now the third point is here, where you have to be aware of. Definitely you can get any sort of issues, any sort of heart problems at any moment, any given moment. Okay, so how you get to know about this, and how, when you have to talk to your doctor, you have to go for a checkup, you have to do your heart test and all that. So that I am going to talk about now, where you have to listen to me carefully. So when you have to stop yourself, all of a sudden when you are getting any irregular heart rate, that is very important. Maybe you have checked right in the morning that it's quite regular, it's okay, but suddenly when you are walking, when you are doing some activity, or when you are even sitting, you are getting some irregular heart rate, which is one of the indications that heart is not working well, and you have to be aware of. You have to if it's exceed, if it's escalate, you have to rush to your nearest healthcare professional for any checkup or precaution purpose. So this is very important. Irregular heart rate is very important. Now, or it could be even irregular heart rate could be like there may have some potassium deficiencies, sodium deficiency. So by that point of time, you can also consume banana or potassium rich food for that point of time. But banana is usually you can get it on instant. If you have, that will be very much useful for that point of time, I hope. Next, chest pain and tightness. When you are feeling any sort of chest pain and tightness, which is very usually we you ignore that it's maybe gas and all that, that should not be sometimes even. So when you are talking about heart, which is very much vulnerable organ, all we know, if it gets failed, definitely we have to lose our life. So we have to be aware of from this point of. And chest pain and tightness, usually I can inform you, this one of the symptoms of angina, which is the heart attack. And so it comes like three types of, which is variant, stable, unstable. So variant is the third stage. So stable, unstable, when you are stable, that time also you are getting chest pain and tightness, something like that. When you are unstable, you are doing some activity, that time also you are getting. So whatever the time you are getting. And variant is the third stage, where you don't get any moment of time to rush to your healthcare professionals, and you have to face some unconditional consequences. So therefore, don't take these things, chest pain and tightness, lightly. Wherever, whatever you are doing, you are athlete, you are doing practice and all that, talk to your coach and stop that point of time. Breathing problem, this is another thing. Somebody having any asthmatic problem or something like that, so they may have some breathing problem, but all we usually know that breathing, it's very much effective. We don't breathe well, so if our heart cannot get oxygen, actually heart means we cannot get oxygenated blood. So it's a process that blood goes through heart, then goes into lungs and gets oxygenated, and then circulated throughout the body. So this is how the things goes. That's all we know probably. So breathing problem, if you have, so you have to stop at that point of time, and you need to exceed those activity any further, and you have to talk to your coaches or your healthcare professional to take care of this issue as well. And definitely I will make you an asthmatic patient or asthmatic problem, or in this winter session how they have to take care of that time. Definitely I will take a bit of detail of these things. So whatever it is, so breathing problem if you have, so you have to be aware of at that point of time. And you have to stop doing that workout and anything. You have to take, rather you have to take rest and talk to your healthcare professional. So this is the main 3 points where you have to look at to stop yourself. That could be happen at any given moment. It doesn't mean that you are okay with the right after you checked in the morning and decided to and you have decided to go with your regular routine, and suddenly you are getting these problems, which doesn't indicate any sort of emergency and all that. That's not, it could be lead towards emergency. So you have to be aware of from these 3 points. Whenever you are getting these three issues, you have to stop yourself and talk to your healthcare professionals. And I can assure you one thing, After following up these tips that I have given already, definitely you will feel better where you are today. And but still we have started a free healthcare guidance and support through WhatsApp. So if you are interested to join with us, let's join with us. It means with AR Sports. AR Sports is a health and wellness sports and fitness company. So we have started providing free health and wellness guidance, or also sports and fitness guidance through WhatsApp, free of cost. So join with us in WhatsApp. The number I have, the contact I have given below, you can go through that contact and just send us hi. You will become our WhatsApp friend, and thereafter you can send any of your issues at any given moment for any health guidance and support, which we will provide you free of cost. And please do share with your issues, so then we can help you out with our initiative. Thanks for watching.